The only diagnosis is when you have a tissue diagnosis, and that's a biopsy.
Endometriosis surgeries without biopsies. So I've come across many women who've shared, I had my surgery, I was told I did or I didn't have endometriosis, despite imaging indicating that I do or don't. And then there's no proof. So, what are your thoughts on these surgeries that take place where biopsies aren't done?
Well, so the rule of surgery, if you remove something, then you don't throw it away into the bin, you send it to the lab. With rare exemption, of course, right? But if we do endometriosis surgery, if we remove a lesion of endometriosis, we have to send it to the lab. We have to send like a tissue which can be analyzed, right? So MRI, ultrasound, CT scan can suggest few things, but the roles of these imaging modalities are accessory, right? The only diagnosis is when you have a tissue diagnosis, and that's a biopsy. What can happen if someone has endometriosis surgery and they see endometriosis and then they take, diathermy forceps and do ablation, then the histology is not sent because ablation means we're not removing anything, we're just burning it. Histology is not there. So therefore, the tissue diagnosis is not achieved. And that's why, again, ablation shouldn't be done. So if we do excision, then you cannot remove endometriotic nodule and not send it to pathology because that's what you have to do. And not only to rule out cancer, although cancer is quite rare with endometriosis lesions, but also to have a confirmation of your diagnosis. And sometimes, especially, outside pelvis on the diaphragm, sometimes you have a spot of something which doesn't look like normal lining. You take a biopsy of it, it comes back either with endometriosis or it comes back as negative. In this case, you again reach the diagnosis, although what you thought would be an endometriotic lesion is actually just a bit of scar tissue. God knows where it, got that from, But, it's important to know, is it endo, is it cancer, or is it something else?
So, to confirm, with a ablation, there's no pathway with that type of surgery because of the lasering burning to actually take a biopsy, would it?
Absolutely correct,
Uh,
yes.